so very much for coming on the show, Teresa. I am just delighted for this opportunity and look forward to speaking with you. But why don't you introduce who you are and the work that you do in healthcare?
And Teresa Wright-Johnson, patient advocate, patient leader. I'm a congenital heart disease survivor, multiple sclerosis warrior. I'm an activist, a writer, an author, and I'm a human. I often say I'm God's child.
So I know you to be an advocate in this space, but can you talk a little bit about why you choose to be an advocate in healthcare?
Sure, I believe in advocacy for two reasons. As advocates, we teach people how to stand up for themselves, how to fight for their rights, how to express themselves, because we all don't have the ability to do that. And I advocate because I believe that by sharing my story and sharing my journey, someone else is empowered. Empowerment is pivotal. When someone truly and honestly believes that their voice matters, then they don't wait for a seat at the table, they demand one. And for me, that has been the cornerstone of my advocacy, sharing my story, listening to other stories. I'm just emboldening people to know your voice matters, silence is not an option. And if you want to see change, you have to be about change. You have to contribute to it. So that is my reason. Those are my reasons for my passionate advocacy. I think growing up into a life of growing up, I had congenital heart disease, of course, and I was going back and forth to the doctors a lot. There were certain things I didn't understand, but I was really fortunate because my parents were very demanding. If they didn't understand something, they asked. And just by watching them advocate on my behalf, I learned how to stand in that gap for myself. And we would have conversations about this, and my mother would tell me, one day you're going to be an adult, and your daddy and I won't be with you all the time. So what will you do? You are responsible for your life. You know how you feel, and you've been taught to listen to your body and those inner voices.
So, for patients who are lower income, patients who are chronically ill, patients who are people of color, who may feel as though their voice have no value in healthcare encounters, what would be your advice to them to own their voice?
You matter. I don't care what socioeconomic community you come from, the color of your skin. Not only that you matter, but you deserve to be heard. It's your voice, it's your right. And my advice is your body will never fail you. Our bodies always tells us when there is something going on. It behooves us to listen. And if you aren't heard the first time, then you keep going back or you go somewhere else until you are heard and your demands are met. Systemically, we still have this issue in the medical field, just as you spoke. And it angers me. It angers me. But what do I do with my anger? How do I channel that anger? I become more of a passionate advocate. Diversity and inclusion, it matters to me. That has become a passionate platform for me because Who are you, or who is anyone to tell me that I don't have a right to proper care and health equity because of my race or my gender or my socioeconomic status?
Based on your patient experience in navigating the healthcare system, what would you say is most urgent in terms of changes within the healthcare system?
I think providers and the entire healthcare spectrum needs to realize the worth, the value of a patient's story and experience. You know, how often do we hear the narrative, oh, well, the doctor says this and the doctor knows best? No, I know best. I know how I feel. I know how my body feels. We have to have a model of partnership. You're my doctor, I'm the patient, but we're partners in this. We're working together for the best possible outcome that will determine my quality of life. I need an active role in that. You can't tell me, oh, let me prescribe this, this, and this, and not listen to what I have to say. You can't, have a visit with me and I have 5 complaints and you don't want to hear them. That doesn't work. As patients, our autonomy has to be recognized. As people, we have to be respected. You don't show up in a business meeting telling someone, you're going to do this, this is that, this is that. You hear all sides and perspectives. You come to the table to collaborate. You come to the table to listen. And that's one thing that needs to be changed. Another thing that I think that needs to be changed, where I'm really passionate about this, is I need to see myself. That's huge. If you say that the number one, the leading cause of death in women is heart disease, and every time I look on the television, or every time I look at an ad or a commercial, and I don't see myself, how do you expect me to really believe that? We identify with what we see. That's huge. So on all platforms, I say, listen, where is diversity and inclusion? I am a woman of color. We are rising in numbers and multiple sclerosis diagnoses. When I look at commercials and campaigns, I don't see many people that look like me. Those are issues. Those are problems. And they can be solved, but nothing can be solved until it is first acknowledged. So I think that there are so many changes that have to occur. Research. We need diversity and inclusion in research. The feat is, I often hear people say, well, why can't we get people of color? And I say, well, what are you doing to make them feel like they are involved? To make them feel like their voice matters. And that's what it all comes back to. A person feeling like they matter, their voice has value, and they're going to make a difference.
Do you see any opportunities for us to use COVID-19 as a teachable moment to improve patient experience and to improve the healthcare industry as a whole?
I believe COVID-19 has exposed what many of us already knew. Those of us in the advocacy space, those of us with chronic illnesses, we have been ignored sometimes for a very long time. COVID-19 exposed the disparities in healthcare. And quite honestly, there were times that, I would hear about, oh, it's the disparities are significant or the numbers are vast. And these disparities have been going on since the beginning of time. This is not a new narrative. So what has COVID-19 done? I believe it has brought to the surface the fiber of healthcare disparities. And it has introduced it into the conscious of America, of society. Because if it's not spoken about on a large scale, then we don't really have to talk about it or don't have to pay attention to it. But when it becomes a pandemic, then we have to start having the conversations. And not only do we have to have the conversations, we have to get to the bottom of why the numbers are what they are and what do we need to do to change it. There's no easy fix. As long as we have socioeconomic differences, as long as we have health food deserts, as long as we don't have healthcare equity, these numbers are going to continue. The problem will continue.
Teresa, what is your call to action to the healthcare industry?
Let's start with grassroots. Go into the communities. Assess the needs of these communities we serve. Don't just talk about where the disparity lays. Come together and figure out and find out what can be done. I believe that when a person commits to a cause, when a person shows up for the cause, and when they level resources, real change occurs. And without dedication, without community resources, that won't happen.
As we're coming to a close in this discussion, do you have any last pieces of advice, any words of encouragement for people, for patients who are navigating COVID-19 in terms of their mental health and their well-being?
If I could say, I guess, any final thing, it would be, if you're here for a reason. We are not here because of the great things that we've done. We're here for a purpose. And as long as we breathe, we can affect change. So I would just like to say to anyone with chronic illness, anyone, who is low spirited, that you are the light you seek. We are in dark times right now, but I truly believe we will come out. The loss and devastation has been significant. Even myself, I go in and out of, I have moments of intense anxiety and depression from all that's surrounding me. But what I have not lost and what I won't lose is hope. So I just would like to say, to anyone who has been affected by this COVID-19, if anyone has, lost anyone has been hospitalized, or, any one of us is just having a hard time, my thoughts are with you. And I believe that we're going to get through this.
I am delighted to have had this opportunity to speak with you and to learn from you. I know our listeners will gain incredible insights from your powerful voice and message. So, thank you for taking this time and thank you for this opportunity.